Hey guys, how we doing? So, how do you know if your doggy has a urinary tract infection? A couple of things that I look for as a veterinarian. Oh yeah. Hey, my name is Dan. I'm a veterinarian, and thanks for joining me today on the channel. A couple of things I look for, guys, would be, is your doggy peeing more? And it's not so much like, do we have a longer, when we go outside, do we just hold our urine and pee a longer stream? It's, are we peeing more frequently? Urinating more frequently should not be happening in any doggy. So for example, you go outside and your doggy walks a couple steps and they're stop, go, stop, go, stop, go. That should not be happening at all. As well, if all of a sudden your doggy is peeing in the house. So if behavioral changes are happening. So dogs don't want to show things that are not normal. They don't want to show weakness. But if all of a sudden your doggy is peeing all over the house and that wasn't happening before, you're right. There could be a behavioral component, and if there's stress in the doggy's life, yeah, totally. You should get that checked out. But the first thing I tell everybody is, if you have a change in urination, either the frequency of it, just the location and the behavior of it, if your doggy is straining, if the stream of the urine is abnormal, and of course, the big kicker, you're noticing blood. So let's say your doggy pees in the living room and it's all over your beautiful new carpet. You take some paper towels, you dab it up, and it's pink. Totally, that's wrong. There should be no blood in the dog's urine. If you're seeing blood in the urine, you should get it checked out. Now, UTIs with blood are incredibly common. What will your veterinarian do to diagnose it? It's pretty simple. They're going to do a urinalysis, or a UA, and usually they'll get it with a cystocentesis, which is a fancy name for just using a long needle and using an ultrasound and poking the bladder directly. Of course, they can always get it called free catch. It's when the dog walks outside, you use a little pan, and they pee into the little pan. That's great, but dude, there's a lot of contamination just from the lower urinary tract, and also the pan and your collecting tools. Like, it's just, if you have to, that's fine, but it's just not the best option. Now, when a veterinarian gets it with a needle, that is definitely the best option. Again, that's called a cystocentesis, and you can ask for that. When you go in, you can be like, hey, do you guys do an ultrasound, and can you collect it with a needle or a cystocentesis? You can say needle. They'll know exactly what that is. So once you get it, they'll do your analysis, and most veterinarians, us included, I work in Omaha, Nebraska, and we use a SediVue, and SediVues are great. They literally do all the work for you. The veterinarian just puts the urine in the machine, the machine runs it, spins it, we'll say, and then it kicks out literally pictures of the urine and tells you all the different fancy concentrations and if there's crystals and all that fun stuff. So a veterinarian, just by doing the urine, I mean, urine is like liquid gold, and you can look at that and be like, yeah, we have a problem. They can also tell from the urine, like, they can be suspicious of like kidney disease, they can be suspicious of stones, they can be suspicious of like diabetes. So the urine, guys, not only will it tell if you have a UTI, but it's going to tell you all kinds of stuff. And based on the urine, you can go ahead and branch out and do more things. So if a veterinarian sees bacteria, red blood cells, white blood cells, it's just dirty, yeah, you have a UTI. Now, if they're going to do an ultrasound to do a needle collection, that ultrasound is also going to allow them to assess for stones. Urinary bladder stones are incredibly common, guys, in dogs, and they will cause repeat and chronic UTIs. UTIs will get better, then they'll come back. So if a veterinarian can do an ultrasound at the same time, my goodness, totally do it, consider it. So they'll do an ultrasound, they'll scan, and they will see these like little white appearing circles, and then there'll be shadows of black behind them, and that will allow them to diagnose bladder stones. If you have bladder stones, you should still get the UTI treated. You should still treat the UTI. Make that bladder as clean as possible. But surgery is, in my opinion, always get your veterinarian's opinion, but in my opinion, surgery is the best option to clean out a problem and get your doggy feeling as good as possible, as fast as possible. You know, a lot of people don't get back in for rechecks. You should get it rechecked. Sometimes bladder infections will completely resolve. Maybe they get a lot better, but they linger. You should always get them checked out to make sure there's no problems in there. And that way, you know, your doggy is happy and healthy and you have nothing to worry about. All right, guys, I hope that makes sense. I hope that helps. Thanks so much for watching. I really appreciate it. You guys take care. Bye.